to be doing depression in less than 5 minutes. So there are different types of depression. There is general depression, there's major depressive disorder, there's seasonal affective disorder, SAD. There's also situational depression. So, sorry, excuse me. What is the patho behind depression? It's a deficiency in 3 key components: norepinephrine, dopamine, and serotonin. And I'm sure you guys have heard of serotonin, which is what is used in a lot of pharmacological treatments. That's what they target. So there's, most of the medications try to get that serotonin receptor. So how are you going to assess a patient that comes in with depression? There's sheets that you can give them, a PHQ-9, which kind of looks if they are at risk for depression or anxiety, or if they're already diagnosed and it's getting worse or better, just kind of looking where they're at. Or a DSM-5, which is a test for major depressive disorder. And then a medical and physical history. And so when you look at the medical and physical history, that also goes with the risk factors. So if a person grew up in a dysfunctional household, if they have a history of abuse or neglect or trauma, if they have a family history, genetics play a role, or big life changes. So that kind of goes under that situational depression. So, they say marriage, divorce, moving, new job, loss of job, all those are really big life changes that can put people in a depressive state. So what symptoms are they going to present with? So they're going to have, these are the normal general symptoms. They're going to be sad, hopeless. They're going to have increased fatigue. They're going to have abnormal eating. Now, not one shoe fits all. So some people will have a loss of appetite. Some people, like myself, when I'm really depressed, I eat more. So then there's a sleep disturbance and despair. So then the more severe form of depression is major depressive disorder, which I was diagnosed in high school. And after my daughter was born with postpartum depression, I was diagnosed with this as well. So what you need to have in order to be diagnosed is you have to have anhedonia, which is a term that means loss of pleasure, for at least 2 weeks. And then you need to have 4 of these symptoms, which is appetite, sleep problems, suicide ideation or attempt, psychomotor agitation, decreased concentration, and a decreased coping, sense of coping. So those are for major depressive disorder. And then how are we going to treat? And the big one to know for antidepressants is SSRIs, which these are aimed at the serotonin deficiency. So we're trying to boost those serotonin receptors to, boost production. And you do that with fluoxetine, which is Prozac. So that is the main one to know. Tricyclic antidepressants, that is another category not as widely used. It's impuramine. And then MOAI, that is not very much used just because there's a lot of adverse effects, but that is phenelazine. And I should have mentioned too with the SSRIs, which 2 stand for selective serotonin reuptake inhibitors. They have the reason they're so popularly used is because they have less adverse effects. So nonetheless, after you figure out a treatment and everything, some examples of nursing diagnosis could be fatigue, hopelessness, insomnia, powerlessness, chronic low self-esteem, chronic sorrow. So it's important to, try to look at all the different factors that might play a role in how severe their case might be. Not one shoe fits all. So that's it for depression. Thank you.